Rachel, we've been through this, or we're still going through the COVID season. What has been your experience on your front line of mental health?
Well, I think there's been a huge increase in demand for consultations about mental health across all the ages, from younger children, teenagers and upwards. All sorts of issues, mostly relating to being locked down, to being more isolated, obviously to losing jobs, to losing people through illness, and it's affected people's mental health enormously. Everyone can have mental health problems across all spectrum of age and demographic and background. It's just part of normal life, like our physical health can be.
Yeah. And I have a very interesting thing, an analogy that if mental health thought as a thunderstorm, that actually anywhere can have a thunderstorm, but some areas are more prone to thunderstorms than others.
Right. Yes.
But I think it's very much the same with mental health. There are some people who are definitely more prone to it, and whether that's genetic or environmental, but actually anyone can fall victim to it. How would patients tend to present? What would their main problems be, do you think?
A lot of people present noticing that they've become more anxious, or that they have a lower mood, they can't enjoy the normal things that they were enjoying. And then some people, it's when others tell them, and other people who they're close to point out that you're struggling in some area, or you're more tearful, or sometimes it's hard to see for ourselves if our mental health is going down. We can't be objective about it, so we need other people around us to help with that.
And how can people if someone notices someone's a bit down or a bit anxious, how can they help?
Well, I think by listening is the most important thing, and to validate that how you're feeling is okay, and it's okay to go up and down in life. It's normal to have good days and bad days, and it's when it becomes a sustained low mood, or it's sustained, then it becomes something that.
And I can remember in training that there was the distinction between being sad and maybe being a bit anxious, and where that then becomes an illness. And the analogy that was given was that it's when it impacts on your day-to-day functioning, and where it begins to have that impact, you then get that snowball effect. So just thinking about mental health, what are the different ways in which it can present itself?
It can affect all sorts of areas. It can affect your sleep, your appetite, your enjoyment of life generally, your concentration on reading, working, studying.
So really quite physical things. So it's not just sort of how you feel, but it's in terms of physical symptoms. They can be very real as well. And we sometimes talk about somatization, which is where our mental well-being or not actually affects physical symptoms. So things like your digestion, your breathing. So it almost becomes impossible to disentangle the mental from the physical.
Yes.
And I think one of the things, and it's been really highlighted through the COVID season, is that it is okay to not be okay.
Absolutely.
And I think sometimes our family members or those we're close to, we spend time with, maybe at work, they always need to have license to have mental health problems. Because I think by recognising them, that it's only then that people can seek the help that they need to pull them through and get to a better place in mind, body and spirit.